Hello, everyone. Welcome back to It's Giving Health, a podcast by Advanced Community Health, where we dive into different topics addressing the community. I am your host, Donnae Ward. In today's episode, we are diving into a topic that is not only timely, but is also essential: childhood immunizations. According to the CDC, vaccines help teach the immune system how to defend against germs. Vaccinations protect your body by helping build its natural defenses. Immunizations not only protect your child during the early vulnerable years, but they also stop the spread of diseases to your family, your school, and your community. With so much information and misinformation out there, many parents still have questions: the what is this, the when, the why, and how to get kids vaccinated. When we talk about setting up our children for healthier futures, vaccinations are one of the simplest and effective ways that we can do this. So here with me is Dr. Elizabeth Johnson, board-certified pediatrician physician, to walk us through some of the facts. Welcome, Dr. Johnson.
Hello. Thank you so much for having me. I'm very excited to talk about immunizations and why they're important for our children and community. So thank you.
Yes, thank you for being here. And so let's start by tell us a little bit about yourself and why pediatrics.
Okay. So my name, like she said, is Dr. Elizabeth Johnson. I am born and raised in Virginia Beach, Virginia, went to the University of Virginia. And then I went to graduate school at Drexel University in Philly, went to medical school at Philadelphia College of Osteopathic Medicine, in Philly, and then did my pediatric residency in Detroit at Children's Hospital of Michigan. When people ask me the question of why peds, the way I always think about it, it's like, why did you put the round peg in the round hole? It just fits. I don't know what it is, but children, they spot me and they're like, that's one of our people. So
that's my people right there.
That's my people. Okay, so I just have a passion for children. Even the jobs I picked in high school were focused on caring for children and things like that. So I love pediatrics.
Yes, wonderful. So welcome. Okay, so let's dive into the question.
Let's do it.
Okay, so we're hearing a lot about vaccines these days.
Yes.
I mean, especially even after COVID and everything, right?
Yes.
So could you walk our listeners through why childhood immunizations are considered such a cornerstone of pediatric health?
Yes, of course. So childhood vaccines are one of the most powerful tools that we have in our toolbox to protect children's health, right? Vaccines are designed to prevent dangerous illnesses such as measles, polio, hepatitis B that were very common before we had vaccines and can cause serious harm and complications such as death. So the idea behind vaccines is that you want to protect a child before they're even exposed to these illnesses. And we do that, especially, it's very important in early childhood because their immune system is still developing. So it's just like the idea of putting on a seatbelt. We put a seatbelt on before we start driving, not because we're supposed to, not because we think we're going to get in an accident, but God forbid we do, it lessens the complications, such as death. So that's the same idea behind vaccines and why it's so important for your children. The idea also is to practice preventative medicine, not reactive medicine.
Okay. Exactly. So let's create a roadmap for parents. So what are the key vaccines children should receive, and when should they be getting them during those first few years?
Okay. So I get this question often, especially if a parent is hesitant about vaccines, they'll ask me the question of, well, which one should I get? All of the vaccines are important. All the vaccines that are recommended by the CDC are critical to your child's health, your elderly parents' health, okay? So the schedule is not just put together randomly. It is based off of years and decades of research and data about when is the best time for this child to get this vaccine. When are they the most vulnerable to contract this illness, this disease, and can have the most severe complications. So your first few years of life is when you get a majority of your vaccines. You're getting vaccinated against things like, I said, hepatitis B, polio, the pneumococcal disease. And then once you hit 1 year old, you're getting the MMR vaccine, varicella, hepatitis A. As you move into your teen years, they are more likely to come into contact with things like the meningococcal bacteria. So you get your vaccine for meningitis and things like that.
Okay. So we often hear the term herd immunity.
Yes.
Okay. Can you explain how vaccinating one child actually helps protect grandparents, the newborns, and just others in the community in general?
Yeah, so the idea and the concept behind herd immunity is when a majority of the population of the people get vaccinated, it builds a buffer around those who can't get vaccinated, right? And it slows the spread of disease. So the way you should think about it is just like if you're building a neighborhood and you're building a lot of houses around the edge of the neighborhood, you're using things that are fire retardant, fire resistant, right? So if there was a fire in the neighborhood, the fire wouldn't jump as quickly to each house, right? Causing, spreading the fire. Or just think of truly nature, right? If you watch National Geographic, Animal Planet, do they still have Animal Planet?
Yeah, they still.
Okay, this is the Animal Planet, right? If you watched anything about just how nature works, look at, wildebeest, look at bison, look at how they protect their herd. That's where it comes from, right? So the herd is stronger in numbers, but the strongest are always on the outside protecting the most vulnerable,
right? The
young, the elderly, the sick. So that's really what we're trying to do, is not only protect your child, but those who can't protect themselves. And my last little point about that, I always tell parents about the story of one of my patients that I had. When you work in medicine and you work in healthcare, you experience the good and the bad, and that includes death. It never gets easy, no matter who you're working with, whether you're working with adults, elderly, but it's especially hard with children. And one of the first pediatric deaths that I experienced was one of my patients who had cancer. And usually children bounce back pretty well with treatment. This child in particular got their first round of chemo, did excellent, was doing great. Came back in for their second round of chemo. A family member picked them up, had a rash, didn't think anything of it. Right? And it was shingles. Okay, so that child died. It was not necessary. He didn't need to die. So that sticks with me. And something that especially sticks with me are the cries of parents. You're never going to forget that at all. So I always remind people, it's not just about protecting your child, but those who cannot protect themselves.
That's a good point. And speaking of being a parent, so I'm a parent. This next question about just like so much misinformation and myths, right? So I could tell you, like, when I just saw my son lick a rock, okay? And when I grew up, they're like, he all right, They say usually them doing those things, that's gonna build his immune system. But let's talk about some of the myths you encounter from parents and the reality behind some of those myths when it comes to vaccines.
Okay, so one of the biggest myths that you hear about vaccines are that vaccines are linked to autism. And it's really, really difficult, to address that misinformation. But I always encourage parents to understand, where did that first come from? So that started from a study. I don't even want to call it a study, really an article that was published by Dr. Wakefield in 1998. And in this study or article, there are only 12 children, which, if you understand how studies and research work,
that's
12 children, it's not appropriate.
It's tiny.
It's not an actual study, right? So took 12 children and took the anecdotal reports from parents rather rather than rigorous data and put that in his quote unquote study and said, hey, there is a link for between MMR and autism, which is not true.
Okay.
So what we've had to do are decades of studies to show that this was not true.
Right.
But unfortunately, that fear still exists.
Yeah.
Even though the article / study was retracted, his license was revoked. And, you know, when they did an investigation, saw that there were financial conflicts, there was misrepresentation of data, all those things, but the damage has been done.
See, that's the thing about the internet too, right? All we're going to do is take that, it's linked to autism. Nobody going to really look at the follow-up.
Yes.
But
like, you know, so I always encourage parents to do your research. And that does not mean that I just read it on Facebook. I read it on TikTok. I heard it on Instagram. Please make sure it's a peer-reviewed study. If you're not sure, you go to your physician, ask them. And if you feel like you can't have a conversation with your doctor, you may need a new doctor.
You need a new, hey, come on. So speaking of that, just let's talk about the reality of some of the potential side effects, or, you know, parents wondering, like, what are the long-term effects of vaccines? What would you say to a parent who has that concern?
So first of all, when someone's concerned, I think the first thing, if I'm speaking to my other healthcare providers, is to listen, right? Those concerns are very real to them. And so you should acknowledge them and listen. But I remind parents, you know, short-term effects are simply things like a sore arm. They may be a little cranky, irritable. You could sometimes have a little knot at the injection site or low-grade fever, but those things pass. As you know, far as long-term effects, that's very rare, and it happens 1 in a million. And we do have a system in place. It's called VAERS, VAERS, that monitors any like adverse effects.
Right.
So you can, you know, readily find that, and it's, you know, monitored by the government.
Okay. So how do you, switching gears now, for parents who decide that they do not want to vaccinate their children? So how do you, the parents who want the more holistic approach? And sometimes I get it. I am a holistic person as well.
Yes.
The way that I do preventative medicine too, lifestyle changes, holistic approaches, right? So how do you support those parents?
So first of all, I absolutely understand that parents, at the end of the day, they have their child's best interests at heart, and they just want to keep them safe.
Right.
And they want to do what they believe is going to keep them safe. So that's the first thing. So I meet them where they're at and have an open conversation. I welcome those conversations, address any concerns or fears that they may have. And then I just remind them, though, that I have no issues with holistic medicine, and holistic medicine and immunizations should work hand in hand. It's not an either or scenario, but it's very important that people understand holistic medicine supports your immune system. It's not a replacement for vaccines, right? So eating properly, getting your rest, taking care of yourself does support your immune system.
Right.
Vitamin C, vitamin D, zinc, iron, making sure your vitamins, you're taking your daily vitamins, are important to your immune system and your overall health, but they do not replace vaccines. They do not protect you from contracting those diseases. Okay, so that's very important. One of the other big misconceptions I see out nowadays when we have this current measles outbreak, there was something going around on the internet that just taking vitamin A can prevent or treat measles. That's not true. Okay. And it's taking a little bit of a truth, taking it and running with it. Vitamin A does have a place in those who are malnourished, so children who are malnourished, and helping preventing severe complications of children who have measles. But taking vitamin A does not prevent or treat measles. So it's things like that. So understanding taking care of your body and having a holistic approach is just as important.
Right.
They should work hand in hand.
Okay. Yeah, makes sense. So how does being unvaccinated or undervaccinated affect a child's everyday life? I know you talked about this a little bit, but from daycare options, right, to school attendance, or just like normal childhood activities.
So it's gonna limit what your child can attend, right? And for some parents, they're like, that's okay by me.
Right.
And that is their choice, and they're allowed to have that choice. From a medical perspective or standpoint, you are increasing the risk of them contracting, certain diseases. That's the biggest thing. So children who are having more ear infections, right? you have the pneumococcal vaccine. And streptococcus pneumoniae is one of the big things that causes ear infection. So a child who is getting sick quite often, those are things that you have to consider. I always tell parents that have made the decision to not vaccinate their children, please, 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 please. It is just your responsibility that when they go into the emergency room or the urgent care, that you do share that.
Oh, yeah.
Okay. Medicine is like looking at a puzzle. So if you're keeping a secret puzzle piece, that's going to affect the care that they're getting. So people need to be aware of that so they can start looking at more things.
Stand on business.
Yes.
Let them
10 toes down. Okay.
And not even like you talked about from a medical standpoint, but what about like socialization? If they're always getting sick.
They're always getting sick, it's an issue. Or just even in times like this, right? When we have measles outbreaks going on, children who are not vaccinated may have to quarantine longer, right? Or isolate. Okay. Measles is not just something that you're like, oh, I'll just let my child just catch it. No, not at all. So I would always recommend to quarantine, things like that. So they're going to miss out on socializing with other children.
So this one, and I think that this is a really important point we talk about public distrust of the healthcare system. And I think when we talk about, especially with people of color, historically, we know why there's this distrust, right? Because we know of the testing without getting consent or anything. So a lot of people still have that, distrust when it comes to healthcare. What do you feel, or what approaches are the most effective when you're working with questions with parents who have this like hesitation when it comes because of that reason?
So again, acknowledging it. The fear is very real and it's based in historical facts. Right. So especially when you are working in a community of color, and especially the African American community, understanding that, the history of this country is steeped in racism. Yeah,
it's real.
Right? Yeah. It's real. So having, studies like the Tuskegee syphilis study where, Black men with syphilis were tested and were not treated for years, for decades, right? And allowed to, some of them allowing the disease to progress to the end of having severe complications or death. Henrietta Lacks, taking her cells without consent and using them for studies. So the history is there. It's very real. So one, acknowledging it.
Thank you.
And having an understanding of where it comes from. You can't really help those who need it the most when you don't understand history. Right. No matter how many times certain people would like to erase it.
Okay. Well, that's that. So last question I have for you. So those first few years, I don't even know when it stops because it's still hectic for me as a new parent. What practical tips do you have for families just trying to stay on top of the immunization schedule? I probably got to get him vaccinated for something now.
Yeah, so I just always encourage parents to make your well visits in a timely manner. I encourage my patients. I know that sometimes, you've been in the office, you're ready to get the kids out, somebody's screaming, all this other stuff, so you want to just leave. Right. But make that appointment before you leave. If I say, hey, because life is busy, you're not going to remember to call in and schedule that appointment. So make sure that you're making that appointment before you leave if it's advised by your pediatrician. Another thing that you can do is ask for a immunization schedule, right? And you can find that on the CDC's website if there is a version for parents so they know like, hey, my child should be getting vaccines at this age. That way you're not playing catch up. If we do have to play catch up, we know how to do it in a safe way, but you don't want your child to associate coming to the doctor and the only time they come is only shots. So we want to make sure that we stay on track. Okay. But that's the first thing, making sure that you have a good communication with your pediatrician.
Okay. Is there anything else you would like to add?
I think that my biggest thing is just making sure that you have a pediatrician that you have a great rapport with, that you can have a conversation with. A pediatrician, in my opinion, should be an extension of your family. Yes. That's how I approach care with children. So I want you, what I mean by that, I want you to come to me and talk to me. If you have questions, if you have fears, we can walk through it together. My job is to be your child's advocate, though. So I sometimes tell parents, I'm like, I'm not going to sugarcoat things. I'm going to keep it real with you and let you know what's in your child's best interest, but I'm there to help you.
Yes, well, thank you. Well, Dr. Johnson, thank you for your expertise today and, laying out the facts.
Yeah.
And for our listeners, I hope that you left today's conversation with a better understanding of vaccinations. If you are looking for a healthcare home, Advanced Community Health welcomes you with open arms. We have board certified specialists ready to serve you. If you would like to make an appointment or schedule a call us at 919-833-3111. And as a reminder, you can catch It's Giving Health every third Thursday for a new episode. Look for us on Apple Podcasts, Spotify, YouTube, Podbean, and also subscribe to Advanced Community Health at Advanced CHC to also keep up with the latest episodes. So with that being said, I am Donnae Ward. I am your host, and
I'm Dr. Elizabeth Johnson.
And
it's Giving Health.